Thank you for choosing Children's Home Health Care. We understand the care of your child is your primary focus, and this short video is intended to provide an overview of our agency. We want to partner together for your child's health care needs. Much of the information shared is also available on our website at www.children'somaha.org/homehealthcare. There you will find links to developmental milestones, immunization and safety information, recall alerts and important product information, and manuals for home medical equipment. If your home is not equipped with internet, please indicate your need for a paper copy. Your parent handbook may be referenced at any time and covers all services offered by Children's Home Health Care, including home infusion, respiratory care, home health nursing, private duty nursing services, home medical supplies, and rehabilitation equipment. Our phone number is located throughout the handbook and on the back cover. Office hours are Monday through Friday, 8 a.m. to 5 p.m. If you need to reach us after hours, on weekends, or holidays, rest assured we have staff on call 24 hours per day, 7 days a week. Please allow up to 30 minutes to return your call. Any emergency situation, always call 911. Always know what to do in case services are interrupted due to weather or natural disasters. We want to know where your family would relocate if services were interrupted. We will ask for you to identify an emergency contact where we may reach you if such an event were to occur and your family relocated to accommodations with power. We are required by law to notify you of your patient rights and responsibilities. It is important to review this information in advance of the care being provided. You may exercise these rights at any time. We also have patient responsibilities, needing information about updated insurance, phone number changes, and address changes, to name a few. In addition, we want you to participate in your child's care decisions. After all, you know your child the best and know how we can best approach his or her care. The charges for your child services are listed on your client equipment rental agreement form as well as on each delivery ticket. Each insurance program provides coverage differently, so we recommend you contact your insurance provider to be fully informed about your coverage. Annual deductibles could mean that you may be responsible for any out-of-pocket costs not covered by insurance. Your client equipment rental agreement also indicates the replacement cost you are responsible for if the children's home health care equipment is not returned when treatment is completed. Please allow us up to 1 week to pick up equipment once it is discontinued. Your insurance will not be billed for any days beyond the physician discontinue date. For billing-related questions, please call during business hours and we will be happy to assist you. Our goal is to provide you with the best possible service, and we want you to have confidence and trust in every provider. You have the right to voice any complaints, concerns, or grievances by calling one of our managers. We want you to speak up if you have any questions or concerns. You may also contact the Medicare Home Health Hotline or the Joint Commission by calling the numbers listed in the handbook. If your child has a life-threatening condition and is age 19 or over, we have information available on advanced directives. Located in the back of the parent handbook is a copy of our Joint Notice of Privacy Practices. We are required by law to provide this notice to you. Please review it and ask your clinician if you have questions. This concludes the introductory portion of your child's admission to Children's Home Health Care. Please let your clinician know of any questions you may have. Thank you again for choosing Children's Home Health Care. We look forward to serving you.
Hi, my name is Grace and I'm a nurse at Children's Home Health Care. I'm going to teach you how to provide phototherapy for your new little one on this video. Now that you have watched our parent handbook video, I will go over how to set up the equipment, how to use it with your baby, and review some of the most important things to remember during this time. A nurse will call you once you've had a chance to watch this video and set up the equipment. She will go into more detail and ask some questions to verify your understanding of this instructional video. Your baby has jaundice, a common disorder of newborns, caused when the bilirubin, a byproduct of the breakdown of red blood cells, is elevated in the baby's blood, resulting in a yellow color to the skin. Used for many years as a safe and effective treatment, phototherapy consists of simply shining blue light onto your baby's skin surface. This light breaks down the excess bilirubin in the skin, which is mostly removed in the stool, and brings the bilirubin back to a lower level. It is important to expose your baby's skin to as much of the blue light as possible. Phototherapy at home allows you to comfortably bond and feed your new baby at home. There is home phototherapy instruction sheet located in your folder that may help answer some questions that come up as we explain how to use our equipment. Your baby's doctor has ordered double bank phototherapy. What this means is that we will use two different forms of phototherapy. One is a light bed called the pet bed, and the second form is a light panel called the BillySoft. First, I'm going to show you how to set up the pet bed. We will take this white tape out of the sleeve. And you will open the case like this. You will see two clear panels on the side. You're going to push those out and push up a front panel that has hooks on either side that will hook into the side panels, securing it into place. Then we have a 3 to 2 prong converter available if you need to use one. With this cord, you will plug this part into the side. And then plug this part into any outlet in your home. If you are worried that your outlet is not safe to use, please use a power surge strip. That will help keep our equipment safe. It is helpful to put the pet bed on a surface off of the floor. A lot of parents find that this will fit comfortably into a pack and play or a crib, which is somewhere away from other people or pets in your home. Please make sure that you aren't placing it on a high surface where the unit or the baby could fall. So to turn the unit on, you will flip that switch, and then it's on. You will notice, especially if you stick your hand in there, that the unit is going to become warm. It should be about 6 to 7 degrees warmer than room temperature. This will help keep your baby comfortable since they will be laying in there with just their diaper and an eye mask on. It's also recommended that you keep the room temperature a comfortable 70 to 76 degrees Fahrenheit. This ensures that the baby and the unit stay at a good temperature for therapy. There is a white pad in here, and I will show you how you can make this a little bit more comfortable for your baby at home. You can take a couple receiving blankets and wrap them around the pad, making sure that whatever you're using to pad on the inside of the bed is not posing a suffocation risk for your baby. You can then take a second receiving blanket and roll it to help fill in the gap between the pad and the plastic part of the bed. Again, making sure that there's no loose blankets in the bed where baby would have a suffocation risk. You can adjust as needed to help keep baby comfortable in the bed. Also, we're now ready to add the second form of phototherapy. The second form is our Billy Soft. You will see on the cover here, it shows you the equipment and it tells you where the equipment goes when it's time to repack it after therapy is complete. So first, you can remove the light panel and the fiber optic cord. You will then see the Billy Soft box here, as well as another cable. There is an additional 3 to 2 prong converter located in the equipment bag if you need to use that. You will plug this part into the back of the box, and then you will plug this into an outlet. You will then take the light panel with the fiber optic cord, and this will magnetize into the front of the box like this, and you'll hear a click knowing that it's in. To turn this equipment on and off, you also just flip a switch. This part of the panel is the treatment side. This is the part where the blue light will come out. You will notice, if you look closely at your equipment, that you will see 6 faded black circles. This is the treatment side, which is where you will need your baby to lay. If you flip it over on the back, you will see that there's printing. There's no blue light emitted from this side. So you want to make sure again that your baby is laying on the treatment side. If you have a different version of the Billy Soft, the panel is a little bit whiter and has a picture of a baby. That will also indicate the treatment side. This light panel comes with a protective cover located in your bag. This protective cover has a thicker side that is more padded. This is the part that you want to lay your baby on. So make sure that the treatment side of the light panel and the thicker pad of the cover are on top of each other. You will then slip that into there. And you will notice there's 2 ties on the bottom of the pad. This is so that you can tie a light bow around your baby to keep them secure on the pad if you wish. Also, if this pad becomes dirty or soiled because baby poops, baby pees, spits up, you can remove this pad, wash it, dry it out, and put it back on. If it becomes soiled beyond repair, let the nurse know. If we are coming to your house the next day to make a visit, then we can bring out an additional one for you. So when you are using both forms of phototherapy, you are going to place this Billy Soft light panel into the pet bed. So you can see when you turn on both forms of equipment, there will be phototherapy blue light coming on top of your baby and also from the bottom. So now that we have the equipment ready to go, let's get baby ready. First, you want to make sure that you undress baby down to just their diaper. You will then find an eye mask located in your equipment bag. The baby will need to be wearing the eye mask at all times while on phototherapy. So first, make sure the equipment is off before you put baby on it because the baby's eyes are not protected at this point. So you'll place baby on the Billy Soft inside the pet bed, and you will put the mask on. Please make sure that it's a snug fit. You can adjust from both sides as these are Velcro. Once baby is situated on there, make sure that as much of their body surface is on the light panel as possible. You can then, if you wish, tie these 2 pieces together to help keep baby on there. Then you can turn the equipment on and baby is ready to go. When it is time to feed your baby, please turn off the pet bed and remove the baby with just the Billy Soft. Once you have removed baby with just the Billy Soft, you can then feed, change, and burp your baby as normal. If you choose, you can put a blanket around your baby to keep them warm, since the Billy Soft does not provide any warmth. You can also move your baby so that their head is off of the lights, and you may wrap a blanket around the baby and the light, making sure not to put anything in between the baby and the light. And as long as you have protected their eyes from the light, as you can see, you may remove the mask for the feed. Once you have fed, burped, and changed your baby, you will put the mask back on the baby before getting them back in the pet bed. Once baby's eyes are protected, you can then remove the blanket Situate baby directly on the pad again, and place baby back into the pet bed. It is more comfortable for the baby if where the fiber optic cord starts, that's where the baby's feet are instead of their head. Once baby is situated back in the pet bed with the eye mask on, you can turn the pet bed back on. That's it. Your baby is ready to go. We are going to ask that you record a little bit of information during this time so that we can update the doctor on how your baby is doing. In your folder, you will find a sheet called the Parent Daily Homework Sheet. Please record your baby's temperature, taken every time you are going to take them out of the pet bed to feed them, in this column here. We would like you to take it under the arm, and the ideal newborn temperature range is between 97 and 99. This column is where we'll have you record the feeding information for your baby. We would like you to mark down how many minutes you nursed the baby if breastfeeding, or how many milliliters or ounces your baby took if bottle feeding. Please put down both pieces of information if you are supplementing. Place a check mark here for a wet diaper and a check mark here for a poopy diaper. The last column is for the number of minutes your baby is off of the lights. We strongly recommend your baby is on the lights continuously. If you need to return to the doctor's office the next day for a follow-up, then you would mark down the length of time you were gone for the appointment so we know how much time your baby spent off of the lights. If you take your baby out of the pet bed for an extended length of time, more than just a feeding, please mark down the time spent off of the lights and why. On the front of your homework sheet, you will see a yellow piece of paper. This just has a few key points on it that I'd like to reinforce. Be sure your baby is fed at least every 2 to 3 hours. This is going to help decrease the bilirubin in combination with phototherapy. Follow any additional feeding recommendations provided by your baby's doctor. Keep your baby in the light bed and on top of the light panel as much as possible. Cradle the light panel along your baby's back during feeds. Keep the eye mask on your baby when the baby is in the light bed or using the light panel as directed. Every time you take your baby out of the bed for feeding, please check your baby's temperature. Also, we have a phototherapy teaching checklist located in your folder. This reviews in a little bit more detail the things that the video covered. Your nurse will review more information with you over the phone and help answer any questions you may have. Remember, we have a nurse on call 24/7. Thank you so much for your time. Congratulations on your new little one, and we will be checking in with you very soon.